Welcome to another edition of Jamaica Magazine. I'm Adrian Atkinson. Between the pages, we work on keeping a vital organ of our body, the heart, healthy. That and so much more coming up on the show. Stay with us.
Whenever you hear the following tone, the Office of Disaster Preparedness and Emergency Management, ODPEM, will be giving information on an emergency situation affecting the island. Please be on the alert and listen to your radio and television for further information. This was a test of the emergency alert system, brought to you by ODPEM.
Good day, I'm Lorraine Mendez, and this is your JIS News for Tuesday, September 29. Prime Minister Andrew Holness and other world leaders are proposing that more private capital be leveraged to support the COVID-19 recovery process. The statement came out of a high-level United Nations virtual meeting of heads of states and governments on financing for developing countries affected by COVID-19. The meeting was convened between Jamaica and Prime Minister of Canada, Justin Trudeau. Approximately $11 trillion has been spent globally in response to the financial impact of the pandemic. Of that amount, 88% has been disbursed by high-income countries, compared to only 2.5% by emerging and developing economies. The world leaders and officials from international organizations argued that public bodies would need the support of global private entities to ward off the devastating effects of the virus on small and developing nations.
The world needs a global plan as innovative, ambitious, and impactful as the Marshall Plan was to Europe's recovery after the devastation of World War II. We must seize the opportunity this time around to make the global recovery plan sustainable to our climate and environment, empowering and uplifting of the poor, vulnerable and marginalized in our societies, and supportive of democratic and transparent governance.
Prime Minister Holness also asserted that technology access should be a priority area of support for developing countries. He stressed that the increased use of virtual platforms as an alternative to the customary physical engagement in many areas makes it imperative for all countries to have access to digital connectivity.
Also a priority concern is the critical need to ensure that vaccines will be accessible to all countries on an equitable basis.
This morning's high-level meeting had more than 60 international participants. This was the second such meeting convened between Mr. Holness and Prime Minister Trudeau. The first was held in May and another is set for December. 199 million Jamaican dollars will be spent by the government to build 2 additional field hospitals for the treatment of COVID-19 patients. Health Minister Dr. Christopher Tufton and Rogers Land Development Limited signed contracts and broke ground for the projects on Friday. One of the field hospitals will be constructed on the grounds of the Falmouth Public General Hospital in Trelawney and the other at the St. Joseph's Hospital and Medical Center in Kingston.
The facility will be equipped both with the infrastructure, the tools, the equipment, and of course, we're making arrangements to ensure that the personnel are also going to be available to give the support to the COVID response that is so important and so necessary.
Dr. Tufton says government is also looking to procure a mobile hospital from Canada to be placed somewhere in the central region of the country.
We are adding an additional 150 or thereabouts. We could get a little more, but about 150 additional beds for COVID. We already have some 350 in the traditional hospital facilities, and we believe that those numbers, when completed, will give us the buffer that we need to respond to COVID in a way that allows those who need hospital care to get hospital care.
Minister Tufton says these new developments are an indication of the government's commitment to seriously tackle the ongoing pandemic in the country while preparing for any eventualities. Meanwhile, health officials in Kingston took to the streets on the weekend and yesterday, distributing approximately 6,000 packages of masks, hand sanitizers and pamphlets. Portfolio Minister Dr. Christopher Tufton, who was joined by community health aides, says the initiative will go across all parishes, with 6 of the 14 being sensitized to date.
It's a standard feature of the work of the community health aides. Behind me in the backdrop here, you see these community health aides. We've hired so far almost 1,000. We are going to hire an additional 300 to 400. They have been trained, and a big part of their job is to go out in communities, in town centers, and be the COVID response representative on the ground to encourage the message, which is so important for everyone to follow, particularly in this time when we're having community transmission.
The health minister is again encouraging everyone to follow the safety protocols of wearing a mask in public, frequent hand washing or sanitizing, and maintaining adequate physical distance from others. He says everyone needs to play their part in responding positively to COVID-19. The latest bulletin posted by the Health Ministry showed 238 new confirmed cases, bringing the country's total to 6,408. Active cases now stand at 4,451. 8 more deaths were also recorded, pushing that total to 101. 12 patients are listed as critically ill, 26 as moderately ill, and 137 are hospitalized. Entities wishing to import alcohol-based hand sanitizers into the country are being reminded that they must have an approved permit from the Standards and Regulation Division of the Ministry of Health and Wellness. The ministry says such entities must have the document in hand before the products are shipped. In a release yesterday, it was revealed that shipments which arrive on the island prior to the approval of a permit are not guaranteed clearance from the ports and risk being seized and destroyed. It also states that the permit issued by the Health Ministry is the only document that authorizes the Customs Department to release a shipment of hand sanitizer to the importer. According to the Ministry of Health, the measure is to ensure the safety, quality and efficacy of the products being imported for sale and use to the public. Since the global outbreak of the coronavirus last year, alcohol-based hand sanitizers have become one of the standards for sanitizing the hands. The other is hand washing. The Health Ministry says it has taken note of the significant increase in the number of entities importing alcohol-based hand sanitizers without the requisite approval. It's warning that hand sanitizers seen on the market that were not approved by the ministry may be seized. The ministry is advising all prospective importers of hand sanitizers or alcohol for local manufacture to first contact the Standards and Regulation Division, located at 45 to 47 Barbados Avenue in New Kingston. And finally, the Ministry of Justice says the Child Diversion National Training Curriculum has moved to an e-learning platform to continue training more members of the parish committees in light of COVID-19. Child Diversion consultant at the ministry, Ruth Carey, says so far the program has delivered training to the parish committees in Manchester, Clarendon and St. Elizabeth. She says training started late last year and continued until March, but with COVID-19 the program moved to a virtual platform.
We trained all of our personnel in the program in the national curriculum, and we are now currently developing a training of trainers program module, which we intend to have delivered in October with our staff to ensure that the program is sustained and the education program continues.
The virtual 4-module training of trainers curriculum will focus on child rights and responsibilities, safety and security in treating with children, the Child Diversion Act, and treatment planning. And that's it for JIS News Today. I'm Lorraine Mendez. Thank you for watching.
To properly carry out a hand rub, apply a palmful of the product in your cupped hand, covering all surfaces. Rub your hands palm to palm. Rub your right palm over the back of your left hand with interlaced fingers and vice versa. Rub your hands palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked. Rotationally rub backwards and forwards the clasped fingers of your right hand in your left palm and vice versa. Once your hands are dry, they are now safe.
We Jamaicans love to say, "me heart." That phrase may be proof that most of us are aware of how important the heart is to our daily survival. But does it mean we know how to keep it ticking? Do we know to eat right and to exercise often to ward off cardiovascular diseases, which is a leading cause of death in Jamaica? Today, in observation of World Heart Day, we examine calorie count.
Your body needs energy, and we call this our daily requirements of calories. And for Jamaican men, it's about 2,100. For Jamaican women, it's about 1,900 calories per day. The calorie is just a unit of energy to say how much energy you need to get around your daily activities and so on. If you're more active and you're not in a desk job, then you're going to burn more calories. If you go to work, when you get up in the morning, you sit in a car and you go to work, you sit at a desk all day, and then lunchtime come, you order and they deliver the food to you, and then you eat that and you go back and sit again, and then you sit in a bus or a car and you go home. So you're sitting all day, you're not doing much, versus somebody who's on the road and they're walking around or they're standing all day like the teachers and nurses and so on. Then you'll realize the difference in how much energy you will need. And so if you are more active, you should be eating a little bit more. But the problem is that everybody is eating as if they're working in sugarcane fields, chopping cane all day. And this is the problem. So we consume more calories than we are burning off. And every day if we keep on consuming calories, you need 3,500 calories to make 1 pound of fat. One soda, if you look on the serving size for these things, these juices and so on, you'll think that, oh, it's just 110 calories. But how many servings come in that container? About 3 or 2.5. So you can easily drink 300 calories like that. And if you do that 5 times for the day, that's 1,500 calories. You almost don't need to eat anything else for the rest of the day. So the excess calories come in the body, and then the body begins to store them as fat. And then you put on more weight and more weight. You have to watch the pastries and the breads and all of these things that people, even when they're vegetarian, they still have a lot of these little snacks and so on. These things are full of calories. You know that one of the cream crackers is about 450 calories. Water crackers is about 500. Yeah, nobody don't want to hear. I never want to believe it either. But this is what you get, the packs that you get, and a lot of people eat them with butter, right? So can you imagine how many calories you're putting in your body with one little snack? And you don't talk about the tea yet, with the milk, the condensed milk and the sugar that you have to have that with. All of these things, they add up without you even knowing.
The ingredients label will go from the most to the least in a product. So if the product is making a claim, look at where that claim is. If it is 1, 2, or 3, because if it falls less than that, you're really not getting value for your money, right, in terms of content. The nutrition facts. One of the first things you're going to look at is the servings per container, and this says 2.5, which means it's 2.5 servings in the container. You are not supposed to drink it, you must share it, right? And then you're going to look at your calories. It says 90 calories, but it's 90 calories per serving, and it's 2.5 servings. So it's 2.5 times 90, which comes out to about 225. And then you come down and you look at your sugar, and it's 22 grams of sugar, but it's per serving. So the entire container is 2.5 times 22, which works out to about 55, 56 if my maths is right. And there's 4 grams equal 1 teaspoon, so you end up with about roughly 14 teaspoons of sugar. And that is, you use this template for all the products that have nutritional facts on them. This is 14 teaspoons of sugar, and the American Heart Association recommends that for an adult male, you're supposed to consume 9 teaspoons of added sugar per day. For an adult female, it is 6 teaspoons of added sugar per day. And for a child, it's less than 6 teaspoons per day. And a child here, we're talking about from 2 to 18 years old. Don't look at a container and judge it by the size alone. It's very important to read the label so you know exactly. And look at it, 220 calories. For parents, we're asking them, to be very mindful of how much sugar they're giving their kids, right? Because it impacts upon their health in the long term.
We try to provide information to parents and guardians, teachers, anyone about the alternatives to these sugary drinks, because really you don't need them in your diet. You can get enough sugar that you need from the foods that you eat, the carbohydrates which are converted to sugars in your body which give you energy. So some of the alternatives are of course water. It's the best one, but there's also fresh fruit juices. So blending your own juices without adding sugar, and you'll have the natural sugars and fiber from the fruits. There's coconut water. It should be, you should actually drink this in moderation because it does have quite a high sugar content, but it is a good alternative. For the children, freezing the juices into popsicles or ice cubes so that it's more interesting for them to drink, as well as doing infused water. So infused water is it's a process where you cut up your favorite fruit or vegetable or even mint leaves or aloe. You place it in water overnight so that the vitamins, the minerals, all the goodness from the fruits and vegetables are infused into the water, and you can have that. It's not sugar sweetened, and it gives you the vitamins and minerals that you need throughout the day. And then for children, there's unsweetened milk. So not flavored milks like the chocolate milks, but unsweetened milk doesn't have a high sugar content, and it also will give the children the calcium that they need for their growing bodies as well.
We're still taking care of the heart. Next, how to get the beats going if there's a sudden attack.
Oscar! Oscar! Oscar!
Though this is a dramatization, it has happened quite often. In the field, at home, or at work, a loved one collapses and is unresponsive. What follows? Usually chaos, confusion, heartache. Instead of immediately providing that critical resuscitation technique which may prevent death.
CPR stands for cardiopulmonary resuscitation. It is a skill that is an emergency skill that is used to revive someone whose heart has stopped beating. Cardiac arrest can happen to anyone at any time. In the event that happens, you need to know the skills that you need to perform to revive these persons or give these persons a chance of survival.
We never know when we can really in a situation where we need to help someone else. It's really just a little bit of your time, and I think it would be a worthwhile investment in learning these skills so we can render assistance.
Even when someone is choking, the techniques learned in CPR may be applied to save that person from asphyxiation. To release the person's airway, position yourself behind them and clasp your fist at the navel and roll in an upward motion. When someone is unresponsive, that's a whole other ballgame. The person may become unresponsive for several reasons. For instance, they could have a medical condition. To really know if someone is unresponsive and in need of CPR,
tap the person's shoulder and shout, "Sir, sir, sir," or "Ma'am, are you okay?" Once the person is not responding to you, and they can respond in several forms. They can answer by moaning, they can groan, they can open their eyes, they can move a limb. If the person is not responding to you, now you need to scan the chest and look if you see breathing. Once the person is not breathing, their terms as being unresponsive. So once you have somebody collapsing, the first thing you need to do is check your environment, ensure that your environment is safe for you. Once the environment is safe, now you need to assess the person who has collapsed. Once someone is unresponsive, has no signs of life, call for help and bare the person's chest. So you remove their upper garments. Find your hand position, it's on the lower half, center of the chest, lower half of the breastbone, and you push in 30 times at the Bee Gees song, that's Staying Alive. Ha, 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 Staying Alive. If you are trained, after 30 compressions, you can give 2 breaths. If you are not trained, you don't know about CPR, you give hands-only CPR. So hands-only CPR is where you compresses the chest. You need to continue that on the way to the hospital, so you're maintaining cells' life.
It's possible for anyone and everyone to learn CPR.
Nannies, construction workers, teachers, lawyers, doctors, everyone should learn CPR. Once you're able-bodied, you can learn CPR.
In terms of age, it's said as young as 12 years old can learn the art to save a life.
So many times, children get in situations that they need assistance. In fact, a cousin of mine, her son got into some distress. She realized that he wasn't breathing one day, and she was able to help him by giving him CPR. So I think that was really important that she had those skills so that she could assist her son, because who knows what would have happened if she wasn't able to give him that immediate assistance.
This course, I've done it before, and I find it very interested because I work a lot with children, and one time I have to do a CPR on a little boy because there was leave under my care and mother wasn't around, and he was eating some plum and playing on like plum seed, stabbing his throat, and I just hear him coughing, but it never very severe because he was coughing. So when he was coughing, I hold him up and I try to do a little, I understand the CPR, tell him to cough. And he cough and cough until it actually come up.
I had a patient once, and while I was there in the bathroom with that person, the person just fell unconscious, and I was there, didn't know exactly what to do, but I was there saying, "Sir, are you okay? Are you okay?" And I didn't know much, what to do, but I decided to put the person on the side, and I was there trying to stop the person, Then I was saying to myself, if I had known CPR well enough, I could perform it.
The Heart Foundation of Jamaica is one of the several local organizations that offer training in CPR.
The Heart Foundation of Jamaica is an authorized training center for the American Heart Association. We offer CPR training for medical and non-medical persons. We have our scheduled in-house training, and organization can call us to schedule classes at their convenience.
CPR!
Are you a small to medium-sized tourism enterprise? Borrow up to $25 million at an interest rate of 5%. You can use the funding to develop and maintain your infrastructure, upgrade or increase your capacity, enhance and expand your attraction, tour or event, and purchase raw material. Call the Exim Bank and ask about the Tourism SMTE loan. Their numbers are 876-630-1400 or 876-618-5889. Tap into the over $3 billion earned yearly through tourism with a SMTE loan.
It's Tourism Awareness Week 2020. The observation ends on October 3. The focus is on rural development and integrating more communities into the industry. Most recently, in an effort to upskill tourism workers from various communities, the ministry hosted online courses. Take a look to find out how that transpired.
Tourism and law, disc jock, food safety. The COVID-19 pandemic shuttered the tourism industry, but the workers used the downtime to upgrade their skills. Not 1,000 or 3,000, but approximately 5,000 tourism workers have gone back to the classroom virtually. They are engaged in online training in a number of key skill areas.
I'm currently doing the hospitality team leader course. The journey has been fun. I'm learning a lot. I didn't expect to be learning so much. When I go back to work, I can bring it back and use it in my day-to-day duties.
The Tourism Workers Online Training Program is part of the government's thrust to ensure the continued development of employees in the sector. It's particularly targeted at workers who were laid off due to the closure of hotels linked to the COVID-19 pandemic.
We have ensured that all categories of workers, those both who are in furlough as well as those who are laid off, have had access to training in one area or another.
Within days after its launch, the free online training program was oversubscribed. The initial budget of $6.1 million had to be increased to $11.5 million. The training is offered by the Jamaica Center for Tourism Innovation in partnership with the Tourism Enhancement Fund, the Hart National Service Training Agency, the Universal Service Fund, the National Restaurants Association, and the American Hotel and Lodging Educational Institute. A few of the courses have already been completed, while others will run until late July 2020. The online training began with an initial 11 courses. Since then, tourism and law has been added with the support of the University of the West Indies Faculty of Law. Approximately 60 industry workers are enrolled in this specific program, which prepares individuals to deal with issues such as sexual harassment.
Our workers, even being at home, are being certified. And a number of them have already gotten and have been showing off the certificates that they're getting from internationally accredited tourism service providers and also academics.
Close to 3,000 persons have completed certification in ServSafe training. This area of study is critical to the continuance of the industry post-COVID-19. It has to do with sanitation and health protocols within the industry. In addition, 55 candidates have successfully completed the Certified Restaurant Server course.
2 groups totaling 192 started training on the 1st of June under the HEART program, and then an additional 1,250 persons are also training in this critical area by HEART.
In addition, the first 19 students in the Certified Hospitality Supervisor course have completed their examinations, and 16 of them were successful. Still more, approximately 220 persons are enrolled in the Spanish program.
I want to ensure that all our workers know exactly what they need to do, how to respond to the variety of different situations that they will encounter, and most importantly, I want them to be trained not just in their ordinary skills, but also in the skills of communicating and supporting emotional activities and developments that may happen around them while they are at work.
Well, I want to say thank you to the Ministry of Tourism for reaching out to the hospitality workers mainly, because I realized that they have a course for the DJs also, but everybody's in hospitality because we want DJs in hospitality too. So I just want to say thank you. It's been a great pleasure doing it, and I'm really looking forward to doing the rest of the classes. I'm really excited.
You have reached the final page of the magazine. Thanks so much for being with us on today's journey. Another show unfolds tomorrow, so come back same time on this same station. Until then, click on our social media pages for more informative features. While there, please subscribe to our pages and channels so you can stay in the know. On behalf of all of us here at the GIS, I'm Adrian Atkinson, encouraging you to stay safe.
This has been a production of the Jamaica Information Service, the voice of Jamaica.